Welcome to A Stride Above podcast, where our commitment to excellence in equine health and athletic performance unites us. Join your host, Dr. Alberto Rulla, as we trot through the essential topics that matter most to you and your equine family members. With over 15 years of experience in equine sports medicine and rehabilitation, Dr. Rulla is dedicated to navigating you through the latest innovations and essential insights in horse health. Together, we'll ensure that you and your horses always remain a stride above the rest.
Welcome to another episode of A Stride Above. Today, I have Dr. Colton Ramstrom here with me today. Thank you for joining us again.
Thank you for having me. Happy to be here.
I have a very, very interesting topic today because I have been asked by many of you to talk about Stringhalt. And because I'm not an expert on Stringhalt, I want to bring a guest that knows a little bit more about Stringhalt than I do. So we're going to ask some questions to Dr. Ramstrom. Basically, the same questions that you have asked me, I'm going to ask him forward, and we're going to get you the information that you need. So the first question that I get asked on Stringhalt, are they all the same? Are Stringhalt cases all the same between all horses?
Great question. Answer is no. Between clinical manifestation, severity, and cause, there's actually quite a bit of variation. We can start with cause, I guess. That'd be a good one. Why is this happening to my horse? Three main reasons. One is a toxin. There's a toxic plant that they refer to as Australian Stringhalt, although it can be found around the world. We don't see it too much here in the States, luckily. Then there's traumatic, so some sort of trauma to either the affected limb, the neck, the back, something that's going to cause a defect in the nervous system that's going to cause the clinical manifestation. And then there's idiopathic. Idiopathic, just fancy word for me that we don't know why. We don't know why it's happening.
We idiots do not know what the heck is going on.
Exactly.
Now, before we talk about treatments, because that's the number two question, how can we treat it? Let's talk about which one is the most common one, the idiopathic, right?
Correct.
And then some people suggest there's a hereditary component to it. Is this proven? Do we know this for fact or not?
I don't know that there have been any studies or any genetic work that actually has pinpointed certain genes, but we certainly see higher expression of the clinical disease in certain families and certain breeds. Clinical suspicion is very high and supported by a lot of data out there that yes, it is.
Got it. Is it painful?
Apparently not. One would imagine so. It might be a little bit startling more than painful, but it's basically a hyperconstriction of a musculotendinous unit that doesn't necessarily need to be painful.
Now, in layman's terms, so that anybody can understand, what is it? What is Stringhalt?
As general as you can put it, it's hyperflexion of one or both of the hind limbs while you're typically at a slower gait, walk, trot. You can see it as you're backing, especially typically exacerbated on tight turns, but it's just that kind of characteristic hyperflexion of one or both hind limbs.
Can they perform? If you have a race horse versus a dressage horse, can they perform with Stringhalt?
Dressage horse, unlikely. You're going to have some very lenient judges to be able to get anywhere in dressage.
Got it.
Racehorse, yeah. We typically don't see that at canter, don't see that at gallop. It's mostly seen at those slower gaits. So There's a potential to have a successful racing horse there.
Okay, that's all great information. So now let's talk about the possible treatments. What has been successful? What's the success rate? Medical treatment versus surgical treatment. What's out there?
Great question. A lot of different medical treatments. So if we'll briefly touch on the Australian. So that's the toxic one caused by that toxic plant. And there are some medications that you can give that do provide some relief, some improvement. We won't go down that line any further though. But as far as the idiopathic, which is what we typically see, or traumatic, you have to figure out if it is traumatic, or if you can not pinpoint anything, then you typically put in that idiopathic camp. Obviously, if it's traumatic, then you try and address whatever injury and dysfunction is resulting from that injury. If we do end up putting it kind of the idiopathic peg into it, then treatment options typically are anti-inflammatory. So you can try DMSO, you can try corticosteroids, you can try Banamine, probably with pretty limited success. I know that some people have had some success, especially in more mild cases, just by treating the hocks with corticosteroids, so standard joint injection in the hocks. And then if you don't get the results that you're looking for there, or if you do have a more severely affected horse, then there are a couple surgery, which I'll let you talk about one, but I'll just kind of introduce the best known one, which is a myotenectomy. So muscle, tenectomy, tendon. They're just cutting part of a muscle and a tendon that runs down the side of the hock that's largely responsible for that hyperflexion of the hock that we see, and that's the lateral digital extensor tendon. So surgeon goes in there, you can do it standing, you can do it under general anesthesia laying down. Pretty straightforward, simple surgery. I think success rates vary pretty highly, but 50% of horses improve from it is what I've seen and what I've seen in the literature. And that's the most common surgical treatment that's used.
Now you also mentioned, so the myotenectomy is the most common one. You also mentioned, I have also seen surgeons just cut the tendon without the muscle. And I wanted to touch base on something very important that you say, that some veterinarians inject the hocks and see what happens, right? There is a disease that is the upward fixation of the patella. And sometimes when the patella, when they're going to intermittent upward fixation of the patella, I have seen that there could be a confusion whether this horse actually has Stringhalt versus upward fixation of the patella, and it usually happens with trainers that are very accustomed, or that they know a lot about the Stringhalt if they work in those breeds that are predisposed. How can you identify one versus the other?
Frequently, if you have intermittent upward fixation of the patella while we're doing our exam, we're not going to see it, right? The horse is more stimulated, they're upregulated, they're typically warmed up from a trailer ride, whatever the situation is. A lot of times you'll see that when the horse is first coming out of their stall, that leg will kind of lock up, they'll get stuck, and then that stifle will pop and they'll be able to flex that limb again. With Stringhalt, you'll typically see it more regularly. So that's one differentiating factor, which is why I always encourage clients to get videos at their farm. Just show me what you're seeing, and then we'll be able to go through it and better differentiate what clinical situation we're actually dealing with.
Pop up a cell phone whenever you're seeing it, early morning before it comes out of the stall, before the vet gets there, get a video of it, and that helps tremendously. Absolutely. That's right. That's a great idea. Very good. Because obviously, two complete different diseases, two complete different treatments.
Yep.
Right. So another surgery, I was recently consulting with a vet in Colombia, because he actually invented a Stringhalt surgery, and he has done several thousands of these, but he has never published it, which is sad. But he says success rate is extremely high, and what it does, instead of cutting the tendon, he basically takes the tendon out of its regular position, puts it somewhere else, closes everything, and then that tendon loses the ability to do that exaggerated movement. And he says his success rate is quite high, especially because there's not a whole lot of hemorrhage, like when you cut the muscle. It's super interesting surgery that I'm looking to bring him over and see if he can actually do some for us, and we can write a paper on it.
That'd be great.
That would be a very, very interesting one. So if any of you have a very, very severe case and want to try, give us a call, because we're really trying to bring this technique to the United States. Seems quite promising technique for Stringhalt surgery. So, oh my goodness, time went so fast. We're obviously having a good time. Anything else that I haven't touched that you would like to tell our audience before we wrap it up?
No, I don't think so. Multiple treatments for this disease, a big thing, and this goes for everything that you guys are seeing on the farm, is get that cell phone out, get videos. A lot of times you're going to be seeing things that we won't be able to duplicate during our exam. And having that video can be extremely helpful for all sorts of different conditions.
Thank you very much for joining us to another episode of A Stride Above. Just like this topic, it came from your request. Feel free to send us requests and we will provide the information that you need to help your horse and help you get a better result.